Here in Norristown, ACLAMO, a community service organization, provides low-income Latinos and immigrants access to resources and programs. 41% of lawfully present immigrants have low income and work in industries with no employer-sponsored coverage. Because of this, immigrants are uninsured and avoid necessary treatment.
ACLAMO is also the safe haven for a lot of communities that are coming new to the county and are considered new in the country too. So people come here for different services.
Nelly Jimenez Alvarez is the Executive Director and Chief Executive Officer for ACLAMO Family Centers in Montgomery County. She's in charge of administration, running programs with her staff, and raising money with the board of directors to make sure the day-to-day operations are ran smoothly.
We have a community health connections program. Under that, we have community health workers who provide services to people with chronic diseases to make sure that they follow up with their appointments, that we support them through the process of their illnesses and making sure that they're connected with specialists in their medical care. So we're part of the medical care with the doctors, making sure that they are following appointments, that they don't utilize the emergency rooms. Instead, we help them to take care of their medical needs before it gets to that point. We also provide health literacy, which means that we have different opportunities for people to learn, get informed, and educated about different health issues.
Program Manager Marla Vega teaches a class in Norristown to spread awareness for breast, cervical, and colon cancer for those in the Latino community. She also talks about risk factors, what symptoms to look for, and guidelines for a screening test. Not only does she spread awareness, but she also makes referrals to places they can receive medical care. Along with cancer, there are other risk factors limiting immigrants' access to healthcare. Language barriers, deportation fears, access to technology, and of course, healthcare literacy. Like cancer, diabetes is also a health problem Latinos face. 16% of Latino immigrants stated it as being their biggest health problem for them and their families.
Cases where people come and said, I have this, I have diabetes or I have cancer, right? So those people may need more long-term care than others may not know. So they may be here with us for 1, 2, 3 years, depending on the needs. So it doesn't really have a set in stone. We never want to turn away people who may need us longer. So we try to make sure that we serve them. We have, like, for example, seniors in our senior program. They come once a month, they get their food that they want, they come for the food demonstration, their vegetables, they're happy, and we don't see them.
One comprehensive service that ACLAMO offers is called the Benefits Acquisitions Program. This program helps those that need to apply for health insurance or any other health-related application. The benefit acquisition specialist on hand not only helps those that apply, but help them follow up with applications and make sure that they get the services they need.
Well, I think like any other nonprofit, we, sometimes are always concerned about, whether if we're gonna get the next grant, right, to keep our services, and that's where I think our board has been very crucial to make sure that we always applying for grants, that we always making sure that we follow up with whatever our funder requested of us when they gave us the money, but also to show our impact in the community. I think ACLAMO is right now it's a journey, right? So it's not said and done. There are a lot of things we still need to learn, and there are a lot of things that we are very good at, and there are other things that we need to improve. So by talking to people, by including other people, the board, the partners, and the clients, and the staff in the process, we're really looking at different angles, whether if we're being successful in one area more than other.